Sole of foot. Welcome to today's session on the sole of the foot. In this video, we will learn the features of the skin and fascia of the sole, the plantar aponeurosis and its functions, the muscles of the sole, arranged in 4 distinct layers, their origins, insertions, nerve supply, and actions, and finally, how the sole supports body weight, walking, and running. Let's begin. The sole of the foot is the counterpart of the hand. Muscles of the sole of the foot are arranged in 4 layers, with the neurovascular bundles between first and second layers, and then between third and fourth layers. Introduction. The structure of the sole is similar to that of the palm. The skin, superficial fascia, deep fascia, muscles, vessels, nerves, and the arches of the foot serve as elastic springs for efficient walking, running, and supporting of body weight. The features of skin of the sole are: it is thick for protection. It is firmly adherent to the underlying plantar aponeurosis. The skin is supplied by 3 cutaneous nerves. The medial calcanean branches of the posterior tibial nerve supplies to posterior and medial portions of the sole. Branches from the medial plantar nerve supplies to the larger anteromedial portion and to the medial 3.5 digits. Branches from the lateral plantar nerve supplies to the smaller anterolateral portion and to the lateral 1.5 digits. Deep fascia. The deep fascia of the sole is specialized to form the plantar aponeurosis in the sole, the deep transverse metatarsal ligaments between the metatarsophalangeal joints, and the fibrous flexor sheaths in the toes. Plantar aponeurosis. The deep fascia covering the sole is thick in the center and thin at the periphery. The thickened central part is known as the plantar aponeurosis. The aponeurosis is triangular in shape. The apex is proximal and it is attached to the medial tubercle of the calcaneum. Proximal to the base is distal. It divided into 5 processes near the heads of the metatarsal bones. Functions of plantar aponeurosis. It fixes the skin of the sole. It protects the deeper structures. It helps in maintaining the longitudinal arches of the foot, and it gives origin to muscles of the first layer of the sole. Muscles of the first layer of the sole: flexor digitorum brevis, abductor hallucis, and abductor digiti minimi. Flexor digitorum brevis. It lies deep to the plantar aponeurosis, originates from medial tubercle of calcaneum. Insertion. The muscle ends in 4 tendons for the lateral 4 toes. Nerve supply. Supplied by medial plantar nerve. Action. Flexion of the toes. Abductor hallucis. Originates from medial tubercle of calcaneum. Insertion. It is inserted into The medial side of proximal phalanx of the great toe nerve supply by medial plantar nerve. Action, abduction of the great toe. Abductor digiti minimi. This muscle lies along the lateral border of foot. Originates form medial and lateral tubercles of the calcaneum. Insertion. It is inserted into the lateral side of the base of the proximal phalanx of the great toe. Nerve supply. Main trunk of lateral plantar nerve. Action. Abduction of the little toe. The second layer of the sole. The contents of this layer are the two tendons, flexor digitorum longus, flexor hallucis longus, and two muscles, that is flexor digitorum accessories muscle and lumbrical muscles. Muscles, flexor digitorum longus, origin from upper 2/3 of the medial part of the posterior surface of tibia, below the soleal line. Insertion. The muscle divides into 4 tendons. Each is inserted to the plantar surface of distal phalanx of 2nd to 5th digit. Nerve supply by tibial nerve. Actions. Plantar flexion of lateral 4 toes. Flexor digitorum accessories. It is so called because it is accessory to the flexor digitorum longus. Origin. It arises by 2 heads. Medial head is large and fleshy. It arises from the medial concave surface of the calcaneum. And from its medial tubercle, lateral head is smaller and tendinous. It arises from the calcaneum in front of the lateral tubercle. Insertion. The muscle fibers are inserted into the lateral side of the tendon of the flexor digitorum longus. Nerve supply by main trunk of lateral plantar nerve. Actions. It flexes the toes through the long tendons. Lumbricals. These are 4 in numbered. From medial to lateral side, origin, they arise from the tendons of the flexor digitorum longus. The first lumbrical is unipennate, and the others are bipennate. Insertion. Their tendons pass forwards on the medial sides of the metatarsophalangeal joints of the lateral 4 toes, and then dorsally for insertion into the extensor expansion. Nerve supply. The first lumbrical is supplied by the medial plantar nerve, and the other 3 by the deep branch of lateral plantar nerve. Flexor hallucis longus. Origin, lower 3/4 of the posterior surface of fibula, except lowest 2.5 centimeters, and adjoining interosseous membrane. Insertion. Plantar surface of the base of the distal phalanx of the great toe. Nerve supply by tibial nerve. Actions. This muscle is plantar flexor of the big toe and plantar flexor of ankle joints, which maintains medial longitudinal arch. Muscles of the third layer of the sole. The third layer of the sole contains 3 muscles: the flexor hallucis brevis, the flexor digiti minimi brevis, and the adductor hallucis. Flexor hallucis brevis. It covers the plantar surface of the first metatarsal bone. Origin. It arises by Y-shaped tendon. The lateral limb form the medial part of the plantar surface of the cuboid bone. The medial limb is a direct continuation of the tendon of the tibialis posterior into the foot. Insertion. The muscle splits into medial and lateral parts, each of which ends in a tendon. Each tendon is inserted into the corresponding side of the base of the proximal phalanx of the great toe. Nerve supply by medial plantar nerve. Actions. Flexes the proximal phalanx at the metatarsophalangeal joint of the great toe. Adductor hallucis. Origin. It arises by 2 head. The oblique head is large and arises from the bases of the 2nd, 3rd, and 4th metatarsals, from the sheath of the tendon of the peroneus longus. The transverse head is small and arises from the deep metatarsal ligament and the plantar ligaments of the metatarsophalangeal joints of the 3rd, 4th, and 5th toes. Insertion on the lateral side of the base of the proximal phalanx of the big toe, in common with the lateral tendon of the flexor hallucis brevis. Nerve supply by deep branch of lateral plantar nerve. Actions. This muscle is adductor of great toe towards the 2nd toe. Flexor digiti minimi brevis. This muscle lies along the 5th metatarsal bone. Origin takes place from the base of the 5th metatarsal bone and sheath of the tendon of the peroneus longus. Insertion into the lateral side of the base of the proximal little toe. Nerve supply by superficial branch of lateral plantar nerve. Actions. Flexes the proximal phalanx at the metatarsophalangeal joint of the little toe. Muscles of the 4th layer of the sole. The structures present in the 4th layer of the sole are the interosseous muscles and the tendons of the tibialis posterior and the peroneus longus. Dorsal interossae. They are 4 in number and lies between the metatarsal bones. Origin. They are bipinnate and arises from the adjacent sides of the metatarsal bones. Tendons are arranged on the abductor sides of the toes. Insertion. First interossae inserted on the medial side of the proximal phalanx of 2nd digit and 2nd to 4th inserted on the lateral sides of 2nd to 4th digits. Nerve supply. Bilateral plantar nerve. S2, S3. Action. It abducts second to fourth digits and flexes the metatarsophalangeal joints. Plantar Aponeurosis. These are 3 in number and lies rather below the metatarsals. Origin. They are unipennate and arises from the medial sides of the metatarsal bones. Tendons are arranged on the adductor sides of the toes. Insertion. Inserted into the medial sides of bases of the phalanges of 3rd to 5th digits. Nerve supply. Bilateral plantar nerve. Action. Adducts the digits and flexes the metatarsophalangeal joints. That's the sole of the foot, its muscles, fascia, and function. Thanks for watching.